Thank you so much. Steve highlighted some of the challenges we were facing when we first started this initiative within CPTR. And I'm going to highlight some of the successes we've achieved since that time, coming together with just the partners within CPTR, but also across other disease areas. That's not to say we don't still have a ways to go. But I just want to go over some of the reasons why we do community engagement again. You all have heard this if you've attended this meeting or other meetings where there have been some of our partners from the field or those of us that are leading community engagement activities at our organizations like I do at TB Alliance. There is a reason why organizations are committing to community involvement in research. Mostly because we want to make sure that our research is planned and implemented and accepted in the most appropriate ways for the locations where we're doing clinical trials. But we want to develop a relationship between the local researchers and the community surrounding clinical trials. And we want to make sure that there's a mechanism for input from key community stakeholders, whether they are potential trial participants themselves, their families, other community members, other key community stakeholders that are influencers in local communities and that are involved in what kinds of health issues are being addressed in their local areas to help them to provide input into the way clinical trials are implemented and conducted in their communities. We want to be able to discuss any potential concerns that communities may have with clinical trials and understand their perceptions of our work. We want to increase their knowledge of what the clinical trials are actually trying to achieve, and also just clinical research in general, if it's a community that has not participated in trials in the past. We want to incorporate input into clinical trial protocol and informed consent documents. This is an area where we actually need quite a lot of improvement, and hopefully we'll see some advances in this area moving forward. And community and stakeholder engagement can also really support a trial in recruitment and retention. Some trials that may be, very large prevention trials may actually rely on community engagement staff to recruit participants directly. In other trials, like TB drug trials, that is not at all what the community engagement staff is doing directly, but the activities of sensitizing communities and really raising awareness about TB and TB drug research in communities can help to support recruitment into trials. And like I said, we want to make sure that there's an appropriate approach, that we're building capacity for communities to advocate for clinical trials that are taking place and future trials as well. And it's a process to help us disseminate results of clinical trials more broadly and with the community base that may not have direct communication with the research site or the trial sponsors themselves. And for those trials that are introducing products, we hope that that will help to build acceptance and uptake of results and products eventually as well. So as Steve mentioned, we wanted to build a way to understand the impact of community and stakeholder engagement more. I think that since 2010, there has been an increasing commitment across all partners to include this in clinical trial planning and implementation. And this has not just been across the TB research area, but all disease areas together. One thing that the CPTR working group did work on in 2012 was an adaptation of the Good Participatory Practice Guidelines that were developed by AVAC in 2007 originally and then updated in 2011. And this is a set of guidelines and recommendations for how to best incorporate community engagement into clinical trials. It was specific for HIV prevention research, but we adapted it to TB drug trials. And that has been adopted by most partners that are involved in the CPTR community and stakeholder working group, those that are implementing TB trials, whether they're doing drug trials for treatment or other areas of research. And the GPP guidelines have also been adapted for other disease areas as well, like Ebola. And I think there's discussions to adapt them for TB vaccines as well. That's, I think, an indication that there's really a broader acceptance for this work and an understanding that it's really needed. And I think that we're moving a little bit more towards support of unified standards to incorporate communities into clinical trials. So because we're coming together to more of a unified standard, it's appropriate that we can say that in partnership across TB and other disease areas, we've been able to define the need for more of an evidence base about what the impact of CSE really is on communities and clinical trials, and that these tools were developed in partnership with other organizations that are working on TB and HIV research. And so, yeah, I mean, measuring the impact of CSE will help us understand what we're doing a little bit more, and also what the impact on clinical trials are, but it will also help us, those that are still struggling, to get others to implement CSE in clinical trials and to get donors to support this kind of work. This evidence base will help us make that justification. So we developed a toolkit. It's called Engagement for Impact. This effort was led by TB Alliance and AVAC, but we had a working group that provided input from the very beginning, including IAVI and HIV/AIDS Network Coordination, International HIV/AIDS Initiative, NIAID, and Wellcome Trust. It's supposed to be a very easy set of tools to use, user-friendly, to help implementers at the site level to document their work. And these tools can be used on a very regular basis, just to document daily activities. It can be to document more program evaluation activities on a monthly basis, to gather more information about how community stakeholders at various levels are understanding the clinical trial that's happening, how they perceive clinical trial in their community, whether they've ever heard about it, and if they did, how were they engaged in that process. It also provides some tools to help CE implementers themselves and also PIs to self-evaluate and understand how are they doing, and how much is there communication between the CE staff at a site level and the PI and also the sponsor. We developed a set of materials. It's a whole manual to kind of talk about the philosophy of doing M&E around CE. And that can be used for training purposes, just to educate people on how to do M&E. The database is a web database, and there's a user guide as well to help people that aren't able to attend one of our trainings to understand and use the set of tools. They are quantitative and qualitative methods that we've incorporated into the set. And like I said, it's on the web, and it's easy to use to input data, and it will help you analyze the data as well. This is just a snapshot of what the set of tools looks like. If you visit engagementforimpact.org, you can read the full manual, look at the whole set of tools. It's available to anyone. Like I said, there are tools that help people document their work on a daily, monthly, quarterly, and annual basis. I've grayed out a few of these tools. Initially, for those partners that are using community engagement to really recruit patients and really want to understand how these activities are helping in that process, we did design tools to track community engagement activities against recruitment numbers. And we also designed some tools to interview trial participants and potential trial participants to understand if they had been sensitized in their communities before they were screened for a clinical trial. We're not using these tools yet because they have not been approved by local ethics committees, and there has been some sensitivity around using them. The rest of the tools are open access at this point. It's really not specific to any clinical trial. It's appropriate for use in any kind of research, TB, HIV, other areas of research. There is also an applicability in community engagement that is around research but not directly attached to a clinical trial. Meaning if you're doing advocacy with broad stakeholder representatives at a national or international level, there are tools in here to help you document that kind of engagement as well. So I'm supposed to talk about just how we developed this and rolled it out, and then you're next going to hear from one of our local site partners on what it has been like to actually use these tools. But it's taken us some time, and early drafts of these tools we actually piloted at several sites, at TB and HIV research sites, to make sure that they were working well, that they really did collect the kind of appropriate information that is being conducted on a regular basis in community engagement. We introduced the toolkit at a forum with TB and HIV implementers in 2014, and that was an early introduction. We actually just asked that group to continue using it so we could develop, so we could collect some additional data to refine the tools and also to develop some of the data analysis pieces of the toolkit. And then we launched it more widely last year at our first ever combined community engagement forum. This is the first time that we brought partners together across TB and HIV to discuss those unified standards of practice and also learn how to use this tool together. So since we've introduced that, all of the participants of that meeting have been trained and are incorporating it into their ongoing programs. We've received a lot of interest from other partners also that want to use it. And to help others that haven't attended our meetings to use it, we're putting together some additional trainings this year. This is just some more information about our CE forum. So we actually brought together over 80 implementers from TB, HIV, and some that have worked on Ebola research as well more recently. And the coordinating partners with TB Alliance, AVAC, IAVI, and also ARIS participated in this workshop. And they represented over 25 clinical trial sites in Southern and Eastern Africa. So out of this meeting, there are other learnings from this meeting that really feed into where we are with developing more unified standards of practice. This is just one element of that. So there have been some challenges, however. The tools are available. They can be used by anyone that's interested just to learn about community and stakeholder engagement or learn about M&E. Anyone can go on the website and open an account. But getting this to be fully incorporated in ongoing community engagement activities has been a challenge. It's a new way of documenting work, and that change in practice is going to take time. It has been a little slow. We do need more data in the system to be able to understand what we're getting from it, and so we're hoping to increase that over the next year. The TB Alliance has actually made this a requirement of grantees receiving funding to do community engagement work, and we're hoping that they'll be able to use this and really improve and simplify the reporting practices for grants and feedback information to us on what they're actually achieving, but also help us to see overall for a program, for any one clinical trial, how are we doing with community engagement? What impact are we having in different phases of trials? Whether we're still planning for trials and communities are doing early education, or whether we're recruiting for trials and we're either having a hard time or an easy time with recruitment, what community engagement activities have been implemented around that time that we can contribute to the success of that. Additional motivation is needed for our partners to continue using this. Additional training is going to be needed for new partners and new users, and also the current users of the system, for sure. Just the overall key goals that we had is we wanted to improve the way implementers are planning their activities, to think ahead when they're creating work plans, to think about creating impact from their activities and what that really means, and how to better create a strategy for engaging community. And to better understand the impact of their work on, like I said, different phases of trials. It's really not something that we had done before, planning activities specifically for an implementation phase of a trial or a recruitment phase of a trial. But there are different things that we can do in communities that really do help to support those phases of trials. So this will help us to look back and analyze what was actually done during this phase of a clinical trial, what was working really well, what actually helped to improve the ease of implementation of this clinical trial, and what could we have done more of to support the trial. And we just wanted to make it easier for implementers to document their work. It's a lot of work to run one of these programs. Like Steve said, it's usually one person that is also only spending a portion of their time on community engagement activities and another portion of their time on other tasks related to clinical trials. So we wanted to make it easier for them to keep track of everything that they were doing and also be able to go back and learn from that. And we wanted to improve reporting for grants as well. So to help move this along, we're going to provide a series of webinar trainings throughout the year. We had our first one already with current partners. Anyone that's interested in opening an account and who does will be invited to any future trainings. We're meeting together again in July with the participants of the workshop last year to do a more in-depth training and talk about how it's actually rolling out. And we're providing more one-on-one support opportunities for those that are really struggling with the system. And we'll also be building some new tools to analyze the data that's coming in as we collect more. Once we have enough data in the system, we will be initiating a data analysis study as well. And this study will be applicable across all implementing partners as well. It's not just a TB Alliance activity. Many partners from IAVI and AVAC are implementing this as well. So thank you very much. If you're interested, please visit the website, learn more about it, open an account, start doing community engagement. Thank you.